Cities are places where we can look closely at the everyday phenomenon of life because there's so much of it happening around us.
It's a very exciting time to be studying cities today because of the very recent availability and the imminent far greater availability of very large amounts of data.
What's amazing about the big data boom is that we're developing a better understanding of how our city works. Never before have we been able to measure in such detail how our buildings and infrastructure operate.
Information that used to be locked up in filing cabinets is now available in digital form. So we can start to study things like, well, why does crime occur in one area and not another? Why does one neighborhood decline? Why does another neighborhood grow?
The goal of the Data Science for Social Good Fellowship is really to take data scientists and train them to work on problems that actually matter. So what we wanted to do was build this hybrid person who has all these different skills but also understands how to take real problems, communicate with people about those problems, solve them, and then help figure out a way to transfer and transition those solutions into the real world. So they went from thinking of a spreadsheet or a database as a data set to actual people behind them, actual stories.
The Master of Science in Computational Analysis and Public Policy is a program designed to create the next generation of leaders in data-driven, evidence-based policymaking. There's no other public policy school in the country that's offering a degree like this. None of our competitors are. So this is the first of its kind to really be a fully joint integration between computer science and public policy in a way that's going to train people in a serious way in both disciplines. Intellectually, this is an exciting time to be starting a program like this because while people have recognized the importance of data for public policy for many years, what's new today is the ability to use data and access data almost in real time.
Lakeside is an approximately 600-acre site that is on the southeast side of Chicago. It is a former U.S. steel factory site, and now it is a brownfield. That means that there are a lot of opportunities down there to develop the site and really make it one of the most sustainable areas in the city of Chicago.
Lakeside is, in size and scope, unprecedented in the United States. And the lessons that can be learned from this sort of project are the way in which social scientists can engage and collaborate with computer scientists, with physicists, with architects, and with developers to think about how to create a community that enhances the health and social life of its residents.
When we start looking at these larger systems, the interdependencies become much more intricate. So for instance, if we plan the energy infrastructure a little bit differently, how could that then impact how the buildings on the site are designed, or how could that impact the water infrastructure? So we want to look at, if we pull different levers, how does that then impact different systems within the site?
MAPS Core is meaningful, active, productive science and service to community. And this is a program that is developing youth, training youth, and employing youth on the south side of Chicago. Their job is to identify every business and organization open and operating for the public, offering goods, services, or jobs that we can use to be a healthier community and more vital community. Community RX is an innovation that's connecting the data that the youth are collecting to healthcare. Community RX injects information into the doctor-patient encounter through the electronic medical record. And the data engine for Community RX are the youth, the MAPS Core program.
Chicago City of Big Data is an exhibition at the Chicago Architecture Foundation, which opens in March 2014. The City of Big Data will use Chicago's data-driven initiatives as the starting point for understanding what urban data is and how it might impact how we design and live.
It's about taking the tools that we have, the scientific tools, the computation tools, the data that we have at our disposal, and using those to make cities and to make lives easier, to make the city easier to navigate, to make the city work better for people.
What we learn that can improve city living, can make cities healthier, safer, can affect the lives of hundreds of millions of people around the world.
Good evening. I'm Don Levy. I'm the Vice President for Research and National Labs at the University of Chicago. And it's my great pleasure to welcome you to this second event in this series, the title being Chicago City of Big Data. The reason we have these sessions is to take some of the most important research being done at the university, being done at the national labs, and try and present it to the public, to the community, in a way where you can listen to the panelists and also interact with them, ask questions, express your own ideas, and there will be a question and answer session at the end. This is the second in this series. The previous one was on the Higgs boson. So there's a question of why we chose this subject. Why is City of Big Data important? And I think it's particularly important to the university, where the university, of course, sits in the middle of one of America's great cities. And it being a great city, it has many advantages, but it also has significant problems, which all cities have. And we're in a position perhaps to study those problems and perhaps to do something about them. We have a very powerful and distinguished division of social sciences. We have a very distinguished school of social service administration, and they've been worrying about these problems for quite some time. But in the modern age, you don't just guess your way at the answer, and in the tradition of the university, you actually need data. You have to take data, and you have to analyze data. And in the modern age, the ability to take a lot of data on a lot of different subjects and to store it and manipulate it with computers is here. And what one needs, in conjunction with the social scientists who are studying these problems, is a way of analyzing these data. So we not only sit in the middle of a big city, but we have the expertise on both sides. We have the social scientists, and in the university and at the laboratories, we have the computer geeks. And where I come from, geek is an honorable title, and I'm not embarrassed to use it, who know how to analyze these data, who invent new ways of analyzing and manipulating the data to try and give an answer to some of the serious problems that this city has and that every city has, in the hopes that we will improve life in the city and that we'll improve life in other large cities. There's an announcement I am told I must make, and that is that during this discussion, the screen will show a live Twitter feed of comments from our live audience and those of you joining by webcast. And apparently the audience on webcast is quite large. So please tweet your comments and questions using the hashtag #UChicagoDiscovery. That's capital U, capital CHI, capital DISCOVERY. And some of those questions will be answered during the question and answer session following the panel. Being of an earlier generation, I have no idea what I just said, but apparently it's important. I would like to acknowledge some special guests who are here tonight. I think, as was mentioned in the video, this summer we had a workshop, not a workshop, but actually a course on the analysis of big data. Graduate students got big data sets from various places and tried to work out ways of using those data sets to analyze problems. And last week we had a high school hackathon for Chicago area high school students and their teachers. And what this was a workshop which lasted all day, where the high school kids and the teachers got together with some of the members from the Data for Social Good program that was run in the summer, and actually tried to figure out what they could do with it. In the end, wrote apps or described apps that they might use to analyze this data. I'm very glad that some of the students and their teachers are here with us today, and I certainly welcome you to that. My last job is to introduce Ian Foster, who is a Distinguished Service Professor of Computer Science at the university, and also a Senior Scientist and Distinguished Fellow at Argonne National Lab, and is characteristic of how this business works. So Ian has a joint appointment, and in addition, he is the Director of the Computation Institute, which is a joint institute between the University of Chicago and Argonne National Lab. And the idea of these joint appointments and the Joint Institute is to take advantage of the best resources, intellectual resources at both institutions to try and work on very hard problems, which you couldn't do in any other way. Ian is internationally famous for his work in computer science, particularly on distributed, parallel, and data-intensive computing technologies. And he's also used his methodology and his technologies and applied them to a number of real problems in science and in social sciences. This is what the Computation Institute is all about. It's supposed to be a meeting of people who develop these techniques, but then apply them to real problems. So it's a pleasure to have him here tonight, and I'll let Ian take the stage from here.
Thanks, Don, for that introduction, and welcome everyone here. Also welcome those who are remote. I think there's quite a few watching the webcast and hopefully tweeting, as Don told us. My children call me a geek. It sounds much better when Don says it, so thank you. So we established the Computation Institute, as you just heard, to tackle some of the hardest problems facing science and society, problems that require the joint work of the best minds of two very great institutions, Argonne and Chicago. Our latest, and I think most exciting initiative to date, is concerned with using the power of computation and what people have come to call big data to understand, design, and improve cities. So 50% of all people live in cities worldwide today. By 2050, that will be 7 out of 10. Because of population growth, the number of people living in cities will double during that same period. Most of that growth will occur in the developing world. So I think it's no exaggeration to say that the health and prosperity of humanity during this next century will depend very much on how effectively we're able to run, design, and hopefully improve the cities in which we live. So that's a very daunting challenge, but excitingly, I think, we have some new tools available to us, emerging new data sources, new computational modeling capabilities that at least offer the promise to transform how we understand urban agglomerations. Can allow us to look deeply into how cities work, to identify and evaluate natural experiments when one thing happens in one place and a different intervention occurs elsewhere. And we hope to provide those people who are charged with designing and running cities with better tools that they can use to evaluate the policies and actions that they propose to undertake before they actually put them in place. So that opportunity is why I and others in the Computation Institute worked with Charlie Catlett to create the Urban Center for Computation and Data, or Urban CCD, as he likes to call it. This is a new research center devoted to improving cities through the latest computational techniques. Charlie Catlett, we're very fortunate to have got him to take on this position. He's a senior computer scientist at Argonne, a senior fellow in the Computation Institute. He's also a visiting artist at the School of the Art Institute in Chicago, so a real Renaissance man. As founding director of Urban CCD, he has been working for some time now to bring together scientists, social scientists and computational scientists, engineers, environmental scientists and others from area universities and labs, not just Argonne and Chicago, to bring together people from the Chicago technical community and also, very importantly, people from the city of Chicago and other regional policy-making bodies. With the common goal of evaluating science-based approaches to understanding and, we hope, improving how cities function. Charlie came to Argonne and Chicago from Urbana-Champaign. He was previously Chief Information Officer at Argonne and the Director of the National Science Foundation's TerraGrid initiative, which was an amazing project to link supercomputers and universities across the country. Prior to coming to Argonne, he was at the National Center for Supercomputing Applications, where he, among many other accomplishments, participated in the development of NSF-Net, one of the early national networks that evolved into what we today call the internet. So he was one of the early people sending emails when the rest of us didn't know what that was. So in any case, please welcome Charlie to the stage, and we look forward to the discussion.
Thank you, Ian. We're going to have our panelists come on, and I'm going to say a few words about this panel, and by way of introducing our panelists, talk a little bit about what each of them do and how we came to arrive at these particular 4 people to talk about big data and Chicago. And I'll start by saying I almost never use the term big data, except to explain that I almost never use the term big data. But I like to think of it as new information sources that can give us better and more insight into some of the challenges that we're trying to address. When we started Urban CCD, this new center, it was clear already that the challenges that cities face are inherently multidisciplinary. And if we were going to be able to understand them and then look for solutions to some of these challenges, we were going to need to have a team that's not just interdisciplinary, but that is interinstitutional. As Don mentioned, we have this mix of sciences and disciplines between the university with the social sciences, policy, economics, healthcare, and the Argonne National Laboratory, where we have engineering and the physical sciences, and the computation resources that we have at both the Computation Institute and at Argonne. Now, we have some unique opportunities here in Chicago to study cities. And I'll just mention 2. The first is that Chicago is one of the leading cities in publishing data about its operation. It's been pioneering open access to the operational data, and because we have this, second reason is because we have this urban expansion project. This is representative at 600 acres, the Lakeside project, of the kind of growth that we're seeing in developing countries like China. The 4 panelists represent a cross-section of the disciplines and expertise that we're harnessing to use these new information sources to bring science to bear on not only urban but global challenges. To achieve the aspirations of the Lakeside project, for example, as a vehicle to bring opportunity and vitality to Chicago, especially the surrounding neighborhoods, we must begin by understanding the challenges, opportunities, and assets that are there today. Kate Cagney, who's sitting closest to me, is a social scientist that's been at the center of working with the Lakeside project to understand the neighborhoods and to pursue the kind of understanding that we need. But the traditional methods for understanding neighborhoods usually look at a few variables at a time. To really understand social systems and economic systems, it isn't a matter of mapping a couple of different colors or looking at 3 or 4 factors to a given challenge. It may be a matter of looking at dozens of factors. To deal with these kind of new sorts of information, we have to bring to bear the new tools from computer science in machine learning and data analytics and predictive analytics. Ghani, who's sitting next to me, has been doing this kind of analytics in industry. He's been doing it as part of the Obama election campaign, and he's come into the city, to the University of Chicago, to not only provide these kind of tools to social scientists and others at the university, but also to train a new generation of students who can go out into the world and tackle those challenges. Now, the new data sources that we're talking about are very diverse. They differ in terms of the rates that they're coming at us. They differ in terms of their format. They are disparate in terms of how complete or incomplete they are. Some data is cleaner than other data. This is a lot of work in computer science challenges just at bringing together the data in a way that allows a social scientist or a community member, a policy maker, to understand the data and to apply some of the tools that Ryan and others are developing. Brett Goldstein, to your far left, has also been doing this kind of work in the startups, in the startup industry in the city of Chicago. And he's working with us here at the University of Chicago to develop a scalable approach, taking some of the lessons he learned from the startup community and from the city of Chicago to build general purpose platforms that we can replicate in other cities, or that other cities can share with the city of Chicago and do their data analytics with our experts. Now, all of these projects, all these aspects, the infrastructure to bring the data together, the social scientists to understand it, the tools to do machine learning and to analyze the data, these all come together in this project here, which is Stacy Lindau is involved in, and to my right and to your left. And this is where it comes together to deliver a value and a service to the people that actually live in the city. So it's interesting science, it's good research that we do, but eventually we want to be able to push solutions out to people that live on the streets. And this is a great example of bringing all these technologies and disciplines together, but not only that, but bringing together institutions that include academia, private industry, the healthcare industry, federal government, and community groups. So that's our panel. We have Brett, who does the infrastructure, the heavy lifting underneath. Raed, who's doing tools that sit on top of that infrastructure. Kate, who is doing social science research on using those tools. And then Stacy as an illustration of the kind of projects that bring those things together and push them out into the community. So with that, I'd like to welcome the panel, and we'll get started with our discussion. So I'd like to maybe ask a question of you, Kate, and then you, Stacy. Each of you works in some way to improve the quality of life in urban areas, the people that live in cities. What is it that intrigues you about that work, and what is it that you're working on that most excites you about working in that area? So maybe I'll start with you, Kate.
Sure. Yeah, I'm going to begin by talking a little bit more about Lakeside. So as you learned from the short video, Lakeside is approximately 600 acres. It rests between 72nd and 87th on the south side. It is a space now, as you can see, that is barren, and one of the things that's most intriguing about the Lakeside space is that it's never been inhabited by people. So that means that there aren't any pre-existing norms, there isn't cultural succession, there aren't these other things that mark how communities change over time. So we have the opportunity to be engaged in this community and in its development from the inception. I'll share too that right now the space is held in a joint venture with McCaffrey Interests, that's the developer, and U.S. Steel as a partner, and they are collaborating with Skidmore, Owings & Merrill to think about the conception and design of the community. And so one thing I think that's most compelling and intriguing and indeed very exciting, and I might even go so far as to say a dream project, is that we can really see how this community is emerging, as we would say, from the ashes of industrial space. One key challenge, and Charlie shared a slide earlier which showed differential employment rates in the communities that surround Lakeside. And one of the things we want to keep in mind as we consider the development of Lakeside is that the communities that surround it are what we might characterize as resource poor. And actually, if you look at median household income in those communities, nearly half are significantly below the threshold of poverty, our federal guidelines for poverty in the United States. So I think we need to think carefully about how to create a new community that's synthetic with the existing one on the south side of Chicago. So one way we hope to address that, and one way we hope to get to some synthesis, is to engage in a set of studies, a suite of studies, one of which will begin with a baseline study, a social survey of the surrounding communities. One reason we want to focus on that is that as social scientists, we believe that social surveys give people a voice. And one way in which we can think about tapping a community's
sense of how they might feel about Lakeside is to speak to the alderman or to go to community meetings. And one thing social surveys do is allow you to talk with people in their own homes and people who don't necessarily have those kinds of connections or the ability to attend these sorts of formal meetings. So we're able then to ask people, what do you think about your community? Do you feel safe on the street? What are your aspirations for Lakeside? What might you like to see here? So we believe that's one set of tools that we actually bring to the table. Another thing we hope we bring is some knowledge about pre-existing research. So we know, for instance, that communities fare better when there's more street activity. People feel safer on the street. What creates street activity? Well, it turns out destinations create street activity. So is there a nearby coffee shop? Can you go to the dry cleaner? Can you walk your kid to school? All of those things create social glue in communities. They mean people make eye contact. And you know, from some of the research we know about here, it's those sort of, you know, what we might describe as weak ties that actually lead to things like chances for employment, that they can be instrumental. They don't necessarily provide emotional support, but those connections can matter. And they can make people feel safer, more comfortable in their communities over time. So, you know, I guess I'll close by saying that we hope all of this work will lead to something that we're describing as a social innovation zone. And by that we mean that it is the social that is the key component. And we think about commercial innovation zones or technical innovation zones. And I know, Charlie, you've been working very closely with SOM, thinking about Lake Sim, which hopefully we'll talk about later on tonight. But it's really the idea that there can be these central locations that create the opportunity for people to gather and to come together and create the kind of safety and connectedness that I described. So, for instance, we could think about Home Depot as a commercial anchor, and we'd like to think about, you know, maybe the fountain in Millennium Park as a social anchor, or a school or a clinic, creating that kind of space in a community that inherently is social. So, so with that, with the social innovation zone, we really hope that Lakeside could be a catalyst for the South Side more broadly.
What about you, Stacy?
So I think, hello, echo.
It's a little echo.
Good evening, everybody, and thank you so much. You know, Kate's work in Lakeside is a good transition, I think, to describing some of the work we're doing under the rubric of something called the Urban Health Initiative at the University of Chicago. And when I think about, you know, we were here about big data. I like etymology, so what's the etymology of the word big? It's actually kind of elusive, but one of the sort of 15th or 16th century uses of the word, which sticks with us today, is generous. So I think the project we're talking about, I'm talking about on behalf of many, many people involved, both at the university and the community, is the idea that we can use data in a generous way to build our relationship between the university and the community and to lift people's lives up. You asked about what are we doing about quality of life. And the idea for this actually came from early engagement with community leaders on the south side of Chicago. We opened the doors, we said we have some resources to do some work that is science, because that's what the University of Chicago does well. But we want to do our science in a way that is of benefit to the community. What ideas do you have? And interestingly, people didn't say you should work on diabetes or you should work on cancer. People said, you should, if we're going to work with you on science, you should do your science in a way that generates data we can use and gives us a deliverable real fast. And people said, and I never would have thought of this on my own, although it makes a lot of sense, you better figure out a way to employ youth. You better figure out a way, if we're going to do science with you, that you find a role for our kids to learn science, to get exposed to the university, and to understand how knowledge can make lives better. That was brilliant. And third thing people said, and I'm a physician, we came from the medical center, was your definition of health is not my definition of health. And what that meant was, and you know, we said we're interested in an empirical definition and being able to monitor health over time. How do we get there? And what that led us to was a question of, if we're interested in working together to transform the health and health opportunities for people on the south side of Chicago, and by the way, all indicators are that if you grow up on the south side of Chicago, you have fewer years of life, you're going to be sicker, you're going to have less access to health care. Those are the realities. If we're going to try to transform the situation on the south side of Chicago with respect to health, what do we have to work with? Now, we can take a deficit-based view, and this is what intrigues me. Actually, Ralph Ellison, who writes Invisible Man, spent a year actually at the University of Chicago in 1961, talked about the invisible and the unvisible. And I've come to realize that what I'm interested in is the invisible. Invisible is what our eyes can't see. We need our glasses, we need our microscopes, and there are lots of people here who do great work about the invisible. But the invisible to me, and this I think relates to some of the ideas Kate was just sharing as a sociologist, social scientist, is the things we can't see because of the social, the psychological, the emotional, the prejudicial barriers that prohibit us from seeing. We don't want to look down there. We avert our eyes, or we choose to see a deficit view of the world. And it is true that there's unemployment, and it's true that it's resource poor. But if we're trying to build something, knowing what we don't have to work with isn't that helpful. So we decided with the community that what we needed to do was identify every single asset we could leverage for the purposes of better health and better vitality. And we had to figure out how to use the kids, so we employed kids, put them in teams with college students here from the University of Chicago. They walked up and down every single block of every single street. Now they've done this 5 years running with a map app, a little phone-based application. And they now, we could share our data with Kate and the Lakeside project. We now know every single business that's operating in all of those communities that you see in the map here. And we know which ones are new and which ones are old. We've put the invisible on the map, and now we're able to connect that information up to real people so they can use it to better manage their health. So it's not really big data, I don't think, in the true sense of the word, but the bigger our data becomes, I think the more we have to worry about what's not in our data. And it's harder and harder to tell. The bigger the data gets, it's harder to tell what's not there. And that interests me.
So let me turn to you, Brett, and then Raid will go next. You've done your work in Chicago. You've worked in the city government, tried to use data and information sources to affect how cities run, ultimately for the people that Stacy and Kate have been talking about. Have you learned some lessons that you can transfer to not only other cities, although that's important, but also to global issues that maybe aren't specific to urban?
Sure. I'll probably give two answers to that. So when Mayor Emanuel recruited me to be the chief data officer for the city, everyone said, oh, we don't do this in Chicago. And that was 2.5 years ago. And here we are today, like we're on a panel talking about the city of big data. Like, it is amazing how far we came. People said we couldn't do open data in Chicago. Chicago, we were able to build within 2 years the biggest open data program out there. So the lesson from this for me was things are doable. That when you have an executive like Mayor Emanuel who says, this is going to be our march, we are going to use data smarter. We're going to integrate, I sat in the policy group in the mayor's office. We are going to mix together your traditional public policy with a quantitative framework. You can change things. When you have that mandate and you start to bring technology into government, you bring innovation into government, you can watch a transformation in 2.5 years. And arguably, I'd say Chicago government is probably one of the smartest quantitatively and forward thinking. Now, how does this become extensible? One of the things we learned in Chicago was it's very simple. You need to break down silos. Everyone operates in their worlds with this is my data, this is my lens, and I only think about my stuff. I spent a couple of years breaking those down and then starting to think about how cities work based on spatial temporal data. How do we forget the details of the event and just consider a point in space and time? And then figure out how can we bring all of this data together and start figuring out how do these points and polygons and things interact with each other. The lessons that we learned in the past few years really they're extensible. They apply to Chicago, they apply to the small town. As we solve these issues of how do you manage big spatial data? You spoke to infrastructure. How do we bring these together in an extensible way? How do we make these techniques and algorithms reproducible? Anyone can start to use it. So you then are able to ask important social science or medical questions, or have people like Raid build tools that will apply to the small town, the big town, things like that. And I think where Chicago, and certainly University of Chicago, are leading the way are, one, a commitment to open source platforms, where when we build things, we leverage things like GitHub, but at the same time, U of C has a commitment to bringing together things like public policy and computer science. We have the new Computational Analysis and Public Policy program. People aren't doing this, and as we create this framework, it's portable.
Right, you just ran this program last summer. You did a dozen projects with 40 students. All of them weren't urban. I mean, what are you learning that goes beyond cities and to global issues?
Yeah, I mean, I think, as people living in America, we're sort of trained to think we're very special and very unique and have very special needs in a good way. And I don't think we're that unique, right? I think what cities are because cities are basically a set of infrastructure and people. And rural areas have the same infrastructure, less so in a light way, and people, fewer. So I don't think there's anything special in that way about cities other than being sort of larger infrastructure, density. So what motivated the summer program we ran at the university, which sort of brought together students to work on sort of social problems, wasn't to improve cities, it was to improve society. And it turns out, if you improve society, the effect is predominantly on cities because most people live in cities. But that's not really the intention to sort of single out cities and say, well, if you live in a suburb, which many of you probably do, you don't matter. Or if you live in, for God's sake, in an exurb or even further away, a rural area, you don't matter. So I think what we really looked at was how do we take data, and I used to say, I used to work with big data, now I just work with useful data. I haven't really worked with big data in at least 3 years. I haven't even seen it in 3 years. It was the Obama campaign, not very much data. I worked over the summer with urban data and lots of nonprofits. Again, not very much data, but I would like to think it's useful data because it's impacting society. So when we worked over the summer, we really focused on large social challenges around education, healthcare, sustainability, transit, public safety, disaster relief, community development, and how do we get information about people and their behaviors that we can observe, and then use tools to predict different kinds of actions they might be at risk of. So take actions such as, what if somebody is really qualified to go to college and do really well, they don't end up applying to college? What happens to them? How do you help them get to college? How do you inform them? Or looking at kids and seeing they might be at risk of obesity, but they get lost because there are too many kids. And when you average out everybody's data, you can't really detect these things at an individual level. Or looking at some of the work happening in, for example, the new Cook County Land Bank Authority around which properties do we invest in that results in sort of maximization of the economic development of the area. So lots of these challenges where you're really predicting risk of some sort of behavior and then designing interventions, very much like Stacey was talking about, is how do we then inform people and how do we change or influence their behavior at a large scale? And so in my mind, what data allows you to do in these types of situations is really be able to make large-scale predictions about very fine-grained behavior, and then also design, well, not design, it's hard to design these things, but how do you then implement interventions, again, at a very personalized level. So what data really lets you do is, in my mind, personalize at scale, and those things apply as much to any large social challenge as they do to urban problems.
So let's talk about actually impacting people in Chicago. I'd like to hear from at least a couple of you on examples where your work has had a direct impact on people we see walking down the street.
Come on, Brett.
All right. Yeah. So my wife told me not to use this example, so just we'll warn you. So one of the things I found in government that was very frustrating was 311. And
I love 311. I call it all the time. I am the most frequent 311 caller in Chicago.
So you're the one who steals our data.
So what are you calling about?
We could look it up and see.
So we can, and you probably skewed the sample. So
but I'm always giving helpful hints for better Chicago.
and I'm sure they appreciate your help.
Somebody's got to do it.
So besides Dr. Lindau's efforts, so looking at 311, the way it was traditionally done was you would call 311 for a given complaint, and it would go and have an SLA that was autonomous of any other system.
What does that mean?
So if you...
No, what was the acronym?
Service level agreement.
Thank you. I'm sure
There we
not
go.
I might be the only one who didn't know
So
that.
this is called the Lindau-Goldstein translation. So it's, if you called in for a pothole, there was a commitment by the city to handle this in X number of days, but it was dealt with on its own. So going back to what I talked about before with the idea of all of these points and actions within the city, and how do you find these interrelations? A great example is we were able to find relationships between certain types of 311 calls, because actually stealing from the medical model, I argued that we needed to start being proactive rather than reactive. So the example I really like, which my wife doesn't like, but I don't think she's here, is we studied the relationship between broken garbage cans and rodent infestation. And we found, and this is important, there's over 26,000 census blocks in the city. And I've argued that blocks and areas act independently of each other. They can have their own behavior. There isn't, unfortunately, a magic bullet. And we found that in certain blocks, that when someone would call in for a garbage can problem, within 7 days, there would be an increase in rodents. But it only happened in certain places. So we were able to launch a pilot where when those garbage cans were called in those target blocks, we would intervene early and then in turn prevent the rodents. So if you envision the model of the future, we as government and we as sort of the community are able to provide these inputs or sensors, and we can start to do things smarter. Instead of chasing our tails being reactive, we can start preventing. And it's a tiny little example, but it was a start how in Chicago we started to do things smarter. So projects like that, I think, get at sort of the future of how we can have smarter government based on data.
So one of the things I think that's interesting here, you sort of glossed over it, but what Stacy's point before was, as you get more and more data, you start relying too much on that data and stop thinking. So one of the challenges that happens with 311 data is people are calling. So you're assuming that if they don't call, there is no problem. And then your entire policy is based on 311 not as one of the sensors, but as the data. And so when you start doing analysis, you overly focus, and there's been a lot of studies like that where, you know, the hurricane in New York last year around election time, where people looked at all the tweets that were coming about the hurricane happened to be from areas that were not affected at all by the hurricane. If you look at 311 data where people are complaining about potholes in areas where they don't have any bigger problems to worry about. So how do we sort of think about, as people who are helping define policy using evidence-based methods, how do we deal with lots of data, and how do you caution people against being too reliant on whatever happens to exist, instead of going out and sort of fixing that problem and being more responsible around it? So.
But I think one answer comes from the group of students who worked with 311 data in the summer program. And they were looking at clustering, right? And the different sorts of calls, so maybe many of them were your own.
Stacy was her own cluster.
She was her own little cluster. But what was so fascinating about the work they did was they really thought carefully about the kinds of challenges that existed at very different levels of aggregation. So were people calling in about potholes? Were they lights in disrepair or sidewalks? Was it about a lot of calls about lawns that weren't mowed? So it was interesting. So some of it was actually related to calls about other private property, but some was about whether or not the city was actually responsive, and that also clustered by neighborhood.
Yeah, I mean, there was a program this summer that Megan at Computation Institute was running, and she had a bunch of high school students going around the city and kind of almost verifying data and seeing how many potholes are here, to kind of validate and see what's actually happening on the ground, as opposed to relying on this data that nobody's ever really verified. And I think that's a great start of looking at what's really behind this data, what's the actual physical instantiation of this, as opposed to just dealing with this bits on a computer.
So I had a
You're
point to
the
make.
311
I was going to build on your excellent point.
I appreciate that.
Well, no, I think the extension, I mean, 311, I know it'll be a running joke now, but whatever.
It's on the Twitters
out
now.
there. Yeah, right. Stacey Lindau clogging up 311. But I think, one extension of like the consumer-facing extension of the 311 example is imagine that the person like I who called actually can see the problem resolved. And whether I see it because you put in your SLA that the problem has been resolved, or I see it because there's no longer a pothole in the street or the street light, is back on. It's that, to extend your medical model idea, the biofeedback, the ability to take big data to identify, maybe prevent, or early response to a problem is the first part. But then how can we use the data to actually feed back to the real human beings who are really behind all the data? And I would say, one of the experiences we've had working with the youth in MAPSCORE has been, which is the Meaningful, Active, Productive Science and Service to Community, the mapping project, because everything needs an acronym, is by taking the data they're collecting and connecting it up to the healthcare system where real patients are getting this information on prescriptions every day, the kids also know they're accountable for the data. Right? If the real world is going to actually use the information, like if 311's really going to tell somebody about the pothole I'm calling in and somebody's going to really fix it, and there's that extra layer of accountability that I think influences whether people are going to call 311 the next time or whether a kid next year is going to sign up for the program. I don't know that I have it quite fully formed, but this notion of the people behind the data and the accountability for the data, the integrity of the data is really important in terms of how we make conclusions from the data.
So I think there's two interesting tracks here. Like, Roy, you raise a great point, and I think this is the scientist side of us. This is one of our challenges for the years to come. We have, how do you handle this? And it's not enormous, but this noteworthy near real-time data, sensor data that's coming into the system. How do we conquer some of these interesting unit of analysis questions that I think we haven't solved yet, and I think are interesting. With that being said, and I'm putting my government hat back on here, one of the dangers in academia, I think, is we want to have the big perfect solution. And no, we need to, maybe our academic side says that, but when we're dealing with real people in the real world, small change makes big impact. I have a personal interest in error in payment algorithms, I know, or whatever. Say you identify 0.1% in a $9 billion budget. That's pretty cool. So small, we need to, in parallel, be willing to do small iterations that make our community or communities better, while at the same time have a parallel track to sort of go for some of these bigger issues.
Mm-hmm. Interesting.
I can think of examples in all four of your work where, to some degree, you're taking data and trying to predict an outcome. And people have talked about predictive analytics, and I think probably many of the folks in the room, and probably some of us on stage, are a little skeptical about the notion that big data can magically predict the future. Maybe you could sort of bring this down to earth, this notion of predictive analytics, and like how, some examples of how we have been able to use data to look for leading indicators and actually do a bit of prediction. And what are the bounds to that today, and where do you think we can get with these techniques?
Yeah, I mean, I think we as people are extremely predictable, as much as we, again, like to feel that we're special and you can't tell what we're going to do. I can predict for the next second what each of you is going to do. It's just sit right there. So it's like the best predictor of I was 99.9% right. And so I think we at least what I talk about is I think we've solved the prediction problem. We all know how to predict things fairly well. Amazon is not great, but reasonable at predicting our next purchases. Netflix is reasonable at doing that. It may not be accurate for any individual person, but as on an aggregate, these tools are fairly simple. All they do is look at your historical behavior and sort of make a statistical model of how you behave. And then given where you are now, it predicts the next thing. So often if you're walking, you can look at people's behavior and say, they're going to put this step forward next. And so if we generalize that to, predicting people's purchase behavior, that's fairly predictable. Turns out when you look at all of our shopping habits, the most predictable habits are, so if you look at supermarket data, you'll find that the most predictable behavior we all have is the impulse buys at the checkout register. They're not impulse buys, they're fairly well predictable. But if you start generalizing that to, it's very hard for us to do it as humans because we are not good at looking at terabytes of data and finding patterns. And terabytes is not big data by any definition. It can fit on most of our computers. But what computers can do is look at large amounts of data and find these markers of sort of pattern which can detect what's going to happen next. And basically that's become now is almost a commodity. You can buy a tool off the shelf and use it to pretty much predict most things you'd like to predict. The challenge is that you still need the experts in an area to come in and figure out what are those starting things. What do if I'm capturing data about my behavior, I need an expert to kind of come in and say, okay, what's important is who you are, your demographics. So, the past couple of years I worked at the Obama campaign, and what we were predicting was, who are you going to vote for? Are you going to vote at all? Are you persuadable? Can I persuade you? And to do those things, we didn't need to know what you buy or what kind of TV shows you're watching. To predict if you're going to vote in the next election, we needed to know, have you voted in previous elections? To predict if you are going to vote for Obama, we needed to know sort of certain basic things about you, around your demographics, where you live, your gender, your ethnicity, your age. And we need to know it about a sample of the people, and we can use that to then predict it about the rest of the country. And we can predict it fairly accurately. I think that the interesting part we're moving towards is, that's one piece of the puzzle, right? So I can predict what you're going to do. The useful part is not the prediction. The useful is, how do I change that behavior? What if you're at risk of some sort of a disease? I can predict it and watch you suffer through that disease. That's not very interesting or useful to anyone. It's how you take action and how you influence this person to change their behavior. That's where the real power is. And I think that's what we're moving towards by kind of just looking at the people here and many of you there, it's those two worlds are kind of coming together, where people who have tools to make predictions and do lots of analysis, and then people who understand the world enough that they can figure out, how do I change behavior of individuals, and you put them together, and now you have something which can actually change society using all sorts of tools that we have access to.
I think, in healthcare, you just described a really a big trend in healthcare. So the insurance companies, all of our insurance companies, are using our data about our claims to hotspot us. And they're looking to see which one of us is about to cost them a lot of money. Okay? And they can do this, and they can do it very effectively. It's the predictable nature of our healthcare spending is very, very high. But then what? So let me just give the example of a patient here on the south side of Chicago, nobody in specific, just a general example, who gets hotspotted by the insurance company. So now what do? Somebody from the insurance company calls up the patient and says, "Hi, I'm really concerned about your health, and I want you to go see your doctor." Well, we don't like advice from our insurance company, first of all. So there's a problem there in sort of who's delivering the message, because we sort of question what their priorities are. But let's say we could get that message to the patient's doctor, and now the doctor calls and says to the patient, "You know what? I've been looking at your records, and I'm just worried that things are going in the wrong direction. Can you come in to see me?" And so that's fine, that works, and there's technology that's doing this, and the patient comes to the doctor, and the doctor says, "Your diabetes is really out of control, and I think there's some things we can do to keep you out of the emergency department, but you've got to really lose weight, and you've got to exercise, and you've got to take care of your feet, and you've got to take your medicine. Bye-bye," and the patient leaves. And the data we have on the other end, especially in less resourced communities, about where the patient's going to go to do those things is awful. I mean, I'm sure there are people in this room who are wondering, why do we have kids walking up and down the street mapping businesses? Haven't you heard of Google? or Yelp.
I think that's what I said to you when you first.
I think you did, and pretty much everybody has. Is there anyone from Google in the room? Okay, I know you're here somewhere, but I'm sorry to say, but the data from the youth, and my colleague Jennifer Maklarski, who is in the audience, is the lead author on this paper, the data from the youth are in every sector of our economy, not just healthcare, 30 to 40% better than the best available data from the commercial sources that everybody's using. Why? We have an invisibility problem. Why aren't all our businesses and social service organizations, and why aren't they on Google? Why aren't they in the mainstream places people go to look for information? Well, these are important questions that social scientists can help us answer. But it reveals the data problem. We've predicted the bad behavior, we've delivered the message, and now we just push the patient off the cliff, or we say, you know what, there's a place where you can go to lose weight, it's called the YMCA, and I'm gonna give you a referral there, but there's a 40% chance when you get there, it won't actually be there. That's the quality of data we are giving people. So at some point, when you're making decisions about sort of where to put your next dry cleaner or what investment you're going to make, having data with 80% certainty or even 60% certainty is fine. But if you're actually going to take those data and give it to a real person and expect that person to act, to change their behavior, and they go there on their last dime and they show up and it's not there, or it's there and they're not eligible, or they're not allowed, or they can't get in the door because there's no ramp for the wheelchair, then all those big data have failed us. Huge waste of time and money and effort. So now I'm getting all riled up.
We should all just leave right now.
Charlie?
So let's just go home.
Call 311. Go ahead.
No, I was just thinking about, sort of linking back more broadly to neighborhood, that some comments you made this summer and some of your work with Bob Gerga about thinking about the composition of a neighborhood, and then what you guys were describing as neighborhood vitality index or neighborhood health index, but trying to look at the constellation of factors that might put a neighborhood on the edge in some sense. Is there some way that you could think about a particular number of foreclosures in a neighborhood, which then might mean that other businesses, or businesses more generally disinvest? Or are there some, or foreclosure accompanied with some level of depopulation? So I was really intrigued by that idea, and the idea that maybe we could then, that could inform interventions at the neighborhood level that could sustain some of those communities.
And maybe I'll turn this to Red, because I think, the question we were grappling with is, if you could track a neighborhood over, say, 50 years,
right,
would you be able to find leading indicators when a neighborhood is about to go into decline, or alternatively, things that happen right before a neighborhood revitalizes or takes off? And can you imagine doing that sort of thing with neighborhood data in a city?
Yeah, I mean, it's interesting because if all the social scientists here are probably just cringing as you say that.